Welcome to CASRN, where I teach you about all things nursing. All right, we are going to jump into the NCLEX and give you a brief introduction on what that test is, what it looks like, and how you can best prepare. To start off, we're going to talk about just the NCLEX explained, computer adaptive testing, the testing areas covered by the tests, and the type of questions that you might see. So the NCLEX is short for the National Council Licensure Examination for RNs and PNs. It's developed by the National Council of State Boards of Nursing, also known as the NCSBN. And the information in this lecture is from ncsbn.org. You're welcome to go ahead and check out that website and glean more information for yourself. This one that we're going to go off of is from the 2019 plan. It does change every 3 years. So this will change again in 2022. And the whole goal of the NCLEX is to ensure that each new nurse meets a specific set of standards. To start off, this test is what we would call a computer adaptive test or a SMART test. Basically, what this means is that the computer selects your next questions based on your answers of the previous question. So if you answer a question correctly, you'll get a harder question. If you answer incorrectly, then we'll get an easier question. So due to the SMART aspect of this and that the computer is adapting to your questions, no two tests are going to look alike, and you cannot go back to a question once answered or moved on to the next one. So you need to answer and that's it. There's no going back. The NCLEX RN is between 75 and 145 items. 15 of those are going to be pre-test. Pre-test means that they do not count against you or for you in any way, but they're using the answers from those 15 questions to gauge whether or not the question they have is a good question. And if it is, then it can show up in the test bank for future tests. There is a 5-hour time limit, and so the NCLEX does recommend that you take 1 to 2 minutes per question in order to finish on time. There are 4 testing areas with 6 subcategories. So really it boils down to being 8 categories. So first off, we have safe and effective care management with a breakdown of management of care and safety and infection control. Then health promotion and maintenance, psychosocial integrity, physiological integrity, that then has 4 subcategories of basic care and comfort, medication therapy, or it's also called pharmacological and parenteral therapies. Then we have the reduction of risk potential or just risk reduction and physiological adaptation. Each of these categories has a percentage of weight on the test. So the biggest one that you're going to see is management of care, which is 17 to 23%. Safety and infection control is 9 to 15%. Health and promotion is 6 to 12%. Psychosocial integrity is the same, as well as basic care and comfort. Then with pharmacological and parenteral therapies, you'll get 12 to 18. Reduction of risk potential is 9 to 15%, and physiological adaptation is 11 to 17. So let's go into a little bit more in depth of what each of those covers. First off, management of care is just going to be prioritizing actions to ensure a safe delivery of care, which basically means, can you recognize who needs to be seen first and in what order they need to be seen in order to keep all of your patients safe? Then we've got safety and infection control, which is protecting your patients from environmental hazards in both the community and the healthcare settings. Health promotion and maintenance is going to cover growth and development, which is pretty self-explanatory, but basically we want to promote health and health maintenance throughout the lifespan. Psychosocial integrity is referring to helping family and the patient cope with the stress of negative health events. So people experience a significant loss in the healthcare settings frequently. So nurses can help them learn how to deal with the stress of those losses, whether they be temporary or permanent. Then we've got basic care and comfort, which is providing assistance and comfort with the activities of daily living, which are also called ADLs. This is bathing, brushing your teeth, getting dressed, etc. And then that medication therapy, or it's also called the pharmacological and parenteral therapies, which is just medications and injections, IVs, etc., is referring just to medication administration, whatever the route. We want to make sure that we're doing it safely. Tens of thousands of people have experienced medication errors in the healthcare settings, so we make sure that you understand medications and how to deliver them safely. Reduction of risk potential is to prevent complications from any form of treatment or the actual illness itself. Then physiological adaptation is providing care and recognizing that an illness changes the body and recognizing how results may change and responding to those changes. For example, if you have somebody who is hypovolemic in that they've lost a lot of volume of blood, and the changes that you're going to see in the heart and the body's attempt to compensate for that, such as an increased heart rate, and then the blood pressure is going to be dropping, and how the body's going to compensate, and then what our treatment plan would be, recognizing that there is a physiological adaptation going on. And if you'd like, you're welcome to go to the NCSBN website, and it has a further breakdown of each of these categories to cover a little bit more of even the further subcategories of these 4 categories. And I encourage you to review those in order to make sure that you're prepared to take the NCLEX. In addition to the testing categories, the NCLEX is going to integrate specific concepts into the test questions. So of course you're going to see science questions. This is going to be relating to psychology, biology, anatomy, and chemistry. As an example, obviously all the sciences are going to be included, as well as the nursing process, caring, communication and documentation, teaching and learning, and culture and spirituality. They want to make sure that a new nurse understands how important these concepts are, and these will be fully integrated into the individual test questions. Different question types that you're going to see are multiple choice, which is just A, B, C, D, and you're going to choose the most correct answer. Fill in the blank is where you have to select an answer to fill it into the blank. Select all that apply are going to have 4 or 5, maybe even 6 options, and you need to select all of the options that apply to the test question. These are very challenging in that you do not get a point unless you select all of the correct options. So these are definitely the least favorite type of questions that nurses have to deal with in nursing school. We've got ordered response, which is going to say, what are the steps that you would do in such and such scenario? And you need to put the first thing that would happen, and then the second, third, fourth, etc. We've got a figure question where you might see an image, and it's going to ask you to identify what's on that image. A chart exhibit is when you're going to have some charts, probably some labs or something like that, that are going to be part of the exhibit, and you need to be able to recognize what those mean, maybe even some EKG strips, and they'll use those exhibits to show that. A graphic option is where your answers are going to be an image of some sort. Audio, you might be asked to listen to heart sounds or lung sounds and identify what's going on there. And then a video, which of course is self-explanatory. So just to rehash what we've talked about, the NCLEX is developed by the NCSBN. It is a computer adaptive or a smart test. There are 8 areas of competency with various integrated concepts. You'll have multiple question types. It's 75 to 145 questions with a 5-hour time limit. Thanks for tuning in. Please help me grow my channel by clicking subscribe and follow below.